Mama Glow really seeks to address maternal health outcomes across a few primary ways. And so one is by training a workforce of doulas. And so we've trained over 3,000 doulas globally since 2018, as well as nurse care managers in doula competency. And then we match doulas with families, right? So we do workforce development, which ensures that families get access to structurally and culturally competent care through doula support to navigate the healthcare system. And then on the foundation side, we have pro bono programs for people who may not be able to afford doula services. And in New York City, we are the largest provider of pro bono doula services. So anybody who comes through that's Medicaid eligible, that's aging out of foster care, that's maybe living within our shelter system, or even a teen mom, those people are eligible to get free doula services through the Mama Glow Foundation. So doulas are non-clinical care providers that offer everything from emotional support to physical support, education, advocacy tools. If you have a partner present, they'll make sure your partner has the tools they need to also navigate the process. And they're also there to help you sort of like, if you think about it, like having a producer for your birth, right? Like if you were doing a wedding and you're planning your wedding and you're like, oh, what are all the details and things I have to think through to make this day very special? Sometimes people hire folks for that, or they engage their family members. And a doula is sort of like that person that you would engage who's thinking about all of the aspects of the experience and how to help it go as smoothly as possible, but also to help you in an emotional way, right? And so in the ways that your providers may not be able to step in to show up for you emotionally, doulas can, right? And so they're there to be sort of this cheerleader and someone who's listening to your unique needs and designing a care plan that speaks to your experience. The shift that the body and the brain require of us actually to move into the process of birthing is under threat with our current medical model, right? Like the way we currently process is like antagonizing to what actually the body needs to feel that sense of safety and security. We don't even think about what it's like for someone to be in a state of space where they're vulnerable, in an altered state of consciousness, like in their body, and then a door's flung open, and then like 6 interns walk in, and someone sticks their cold hands up in your cervix.
Right.
Like, what is this? Right. And so, but it's your fault that you're not relaxed. It's your fault that you're not opening. Like, we have language like failure to progress. Like, why is it failure? How come we're not languaging in ways and thinking about the impact of that language, and also thinking about the impact subconsciously? Because when people are in an altered state of consciousness, they actually fall into like very deeply and easily into sort of a trance-like state, right? And so that means they're actually more susceptible to the things that are being said around them. So we have to be actually even more careful with our language, because people internalize it like even more, because if you think about like where their brain waves are, right? Like the amplitude of these waves, right, mean that they're in this altered state. So we're actually like not at all considering this actual experience that's happening. We're just seeing it as physical. We're not thinking about the greater thing that's happening with the brain and the body and this in our endocrine system and our sex organs and like everything working together, as well as like stuff that we can't really quantify, that's more sort of your own ancestry and your own stories and the things that are in your tissues that you carry forward and the epigenetics, right? We're not thinking about that.
What is the perception of doulas to
Yeah.
midwives over OB? Are they generally welcomed to the bedside, so to
Yeah.
speak?
So
Or
doulas are on the federal agenda. And so expanding doula access has been sort of a push for the last, I would say, maybe like 4 to 6 years, right? Like really trying to,
at the
also
federal
find,
level? Like,
yeah,
oh, okay.
absolutely. Yes. And so
So
there's,
I'm sorry. So you're non-medical, but
Mhm.
you are accepted as part of the medical industry then on some level.
Yeah,
Then you're
we design
allowed into the
doula
hospital and into the
benefits.
hospital room and
Yes.
stuff. Okay.
Hmm.
Yeah, there's doula benefits for insurance, so people can get benefit coverage
Yes.
Oh
through
yeah.
insurance
I
providers.
have been hearing
Mhm.
about that, which is
Yes.
so cool.
We
Like
designed
employers.
the very first one for one of the largest companies in the country, is in its second year of piloting. Will expand across the country
Oh,
soon, but
that's
we do it
amazing.
in like 3 states currently.
That's actually, I mean, for what it is, that's actually, I think, a pretty short path to get to
Yeah.
that. Actually, that's
Yeah, it's
pretty
not that much
accessible to
work.
people.
It is accessible, it's affordable, for the
Yeah, a
most.
lot easier than going to college for 4 years. You know.
Yeah, and we also have collegiate programs. Like our training program is embedded at Brown University, where I'm a professor, and I teach it to students who are like
Oh,
OB-GYN, public health, medical anthropology, public health students, people who are doing bioethics. Like those are the students that I teach there, and they get this course over 12 weeks. And so
hmm.
there's more components to it because they're taking it over a semester than people who are taking it over 6 weeks. So,
This has been a Shut Up production.
Shut up!